Our subject on biomedical ethics is very relevant today. You agree with me? Very important, very relevant in the church, in the modern world, as well as in the Catholic Church. The church, in the world, as well as in our life. We can't think of our life, human life, without the help of science, without the help of technology, without the help of biomedical ethics. We need them in our day-to-day life. We need them in our day-to-day life. Because biomedical ethics has much to do from the beginning of our life until the end of our life. The class on biomedical ethics will be really an exciting one because we deal with many topics which are connected with our life, our health, our human dignity, human value, etc. Okay? Now, what is biomedical ethics? What do you think of biomedical? Biomedical ethics. Ethics already you have learned in philosophy, good or moral or what you call principles of philosophy. But what is biomedical ethics or bioethics? We will come to later about the definition and But then just to begin, the starting point, the biomedical ethics. What do you think? Biomedical ethics. Yeah?
Moral values.
Moral values, okay. Good.
Study of living beings in a scientific manner.
Very good. Study of living beings or human beings in a scientific manner. Good. Okay.
In the case of death, taking a judgment of right and wrong.
At the point of death, whether this is right or wrong. Okay. So biomedical ethics is a study of ethical issues relating to the provision of health care, as our brother said, to emerging biotechnologies and to biomedical research. I repeat, biomedical ethics is a study of ethical issues relating to the provision of health care, to emerging biotechnologies and to biomedical research. And again, medical ethics is a branch of ethics. Medical ethics is a branch of ethics that deals with moral issues in medical practice. We'll deal elaborately in coming class, the definition and the terms, bioethics, biomedical ethics, etc. Now, my class, this is a class of introductory talk or introductory class. I will try to make it as light I can. Okay, I will try to make it as light. I don't want to burden you. Okay. Also, I want to remind you that I am not a medical doctor. Although we deal with biomedical ethics, I am not a doctor, nor I am a scientist. No, I want to admit that my limitations also. When someone gets up and asks, father or professor, when this corona will get over? What about the vaccine? I will be in trouble. It is not that easy to answer. There have been different companies and institutions and medical colleges, thousands in the world. They are in the research now, trying to find a medicine, vaccine. Still, not 100% they have given. It is working, but not still 100% assurance they have given. So, any questions related to ethics and science? If you'd ask, I have to admit myself that I am not a scientist, but rather, what our church says, church view on science, church view on bioethics or biomedical ethics, sure, I will be able to do justice to you. Okay? You get me what I want to say?
Yes, sir.
Because I'm not a doctor, I'm not a scientist, to answer technical questions. Okay? But then I shall try to help you whatever I have learned, what our church teaches. Okay? The position of the church with regard to biomedical ethics. Also, I will summarize the things that are commonly known and the schema that has been given to me by the faculty and what exactly the church wants to tell us while we learn biomedical ethics. Now, advancing medical technologies of today bring tremendous opportunities and new moral problems. We need science and technology today. No, you can't think of a human being or what you call people on earth without the help of science and technology and medicine. No, we need them all for a better living, for a comfort life, or to say even for a long living. You want to live long, 100 years, 110 years. There are people, with the help of technology, with the help of medicine, they are able to live, more than 100 years. So the technology in our human life, it brings a tremendous change, or it brings a lot of opportunities, to grow better, to be healthy also, and gives a lot of job opportunities, and brings a lot of solution to the diseases and health issues. But at the same time, there are also moral problems. Science has grown so much today that becomes part of our life. As I said, we cannot think of human life or the modern world without science, medicine, and technology. Science and modern technology have made our life so easy and comfortable, especially at the time of our sickness and when we are down with issues like now corona or malaria, dengue, whatever. The science and technology, the medicine helps us to heal, to get back to our normal life. You agree with me? Imagine you suffer with a headache and fever, and you take a tablet. Within no time, what happens? The headache and the fever, it disappears. No more. You feel okay. You become normal and begin your daily routine, without any intervenience. Also, we take the prescription when it is in the case of viral fever or some other symptoms. We go to doctor. We meet doctor and consult. What is exactly the fever? Is it normal fever or a virus fever? We don't know. Then we go for blood testing and urine test, etc., etc. Then doctor gives a prescription of medicine, or what you call, for a period of 10, 14 days or 1 month. So you take them for 1 month. Again, you become normal. We become normal. We become all right. Again, you continue our daily routine. Or imagine you are playing a basketball and you fell down with twisting your leg. Your leg got twisted and there's a ligament on your knee. Now what happens? Again, you go to doctor. You take X-ray. You provided you need to do MRI scanning. MRI scanning, magnetic resonance imaging, MRI. Magnetic resonance imaging is a MRI scanning. So in case you need to go deeper, the X-ray doesn't show some things. Doesn't show exactly what has happened. Then the doctor may advise you to do MRI scan. We do MRI scan, then we come to know what has happened. Where is the twist? Where is the ligament? There is a disconnect between the two muscles or the joint, etc., etc. So we take again the medication. Whatever doctor says, we undergo the medication. Maybe 1 month or 2 months of bed rest. Again, we become all right. So once again, thanks to the science, the medical technology that helps us, the human beings, to continue or enjoy our human life without much, any inconvenience or intervenience that comes on our way with our sickness. Now, in our topic, biomedical ethics, things that to be dealt are beginning and end of life issues, from the birth, till we die. That are the issues that we are going to deal in our biomedical ethics. Also, the sanctity of life, which means the holiness of life. The human life is holy because we received as a gift from God. Human life is not something that sells in the market, or we can't compare with animals or other beings. Human life is precious, and it is a gift that we received from our Creator. It should be preserved and it should be valued, respected. That is the holiness or sanctity of human life. And of course, we will also deal with the principle of double effect theory that I don't know if you have learned in philosophy or in your first and second years, I don't know, but we will deal again. What does it speak about? The principle of double effect theory. Also, what you call topic abortion. It is very common. We all know what is abortion. Of course, we'll deal everything. As I said again, the dignity at the end of life and euthanasia. You know what is euthanasia? Mercy killing. Do you want to be killed? No. You want to be killed. You want to live. People want to live, no? People want to live more. Nobody wanted to be, no, killed using euthanasia. Again, the Christian meaning of suffering and death. Why there is suffering? Of course, it has got to do with the spirituality and other theology classes also we learn. But then, what does what you call a moral understanding, or what does moral theology say about, no, our human sufferings and death, especially, no, when we are down with sickness, when we suffer, no, with various diseases. Again, artificial insemination. You know what is IVF? IVF. No? You didn't learn IVF? In vitro fertilization. In vitro fertilization. We'll deal slowly, okay? We'll deal in our topic. Again, organ donation and organ transplantation. You know, there is a difference between organ donation and organ transplantation. You know, suppose, no, there are people, bishops even in Kerala, even in Tamil Nadu, there were bishops, no, after my death, no, I donate my organs to the medical college. Recently, the Bishop of Trichy, no, before his death, he made a will, no, he wrote a will, no, after my death, that my organs be used, no, St. John's Medical College at Bangalore. So after his death, the ambulance came from Bangalore, no, took him away to the hospital. They kept him there for 2 or 3 days. Then they brought back the remains, no, of his body. Then they buried him at the cathedral. So before his death, he made a will that my organs to be used or made a research in St. John's Medical College at Bangalore. No, that was there is another bishop in Kerala, bishop or priest, I don't know. He is living, I think he is living, but then he made a will, after my death, let my eyes be, no, donated or to somebody, no, who is in need of. Also many, priests and religious, even lay people, they come forward to donate, after my death, let my organs be used for, some people, those who are in most need of. Also many, accident cases, there are many good many movies which contains a lot of morality. I have seen many movies, at the death of their son, the parents, they decide to donate the heart. They don't decide to donate the heart to another being. Now, the possibility of carrying this heart from one hospital to another hospital by ambulance is a challenge of that movie. Is worth watching. There are good many movies that are connected with the medical issues and organ donation and organ transplantation. Now, today, the organ transplantation has become a commercial business. People they make a business. Even today in India, many people they sell their kidneys. I don't know if you are aware of it. Maybe to educate my child. Maybe I'm living in a life of poverty. To eradicate my poverty. My poor life in the family. I want to educate my son, so I sell one of my kidney. I don't know if Pope Francis is the one kidney. I think. He has not done any business or no, but one kidney is affected, but he has got another kidney that functions. I don't know if you are aware of it. Pope Francis, he doesn't have 2 kidneys. He is having 1 kidney, but he functions well. He has not sold or what kidney, yeah, but he has not done any business. Okay, he has not done any business or no. But then what I want to say, people they also live with 1 kidney and other one they sell. Today I'm hearing from different people, people who are affected with corona, do you touch them? We are not permitted to touch, but do you dare to touch? Even if they ask you, they give you permission to touch the corona patients, will you touch? No, we are afraid. We are afraid of the virus. Now, what about that man who is, died of corona? They close and give you. They put in the parcel, they close it and they give you. You don't even see sometimes the face. So in such situations, what happens? The organs that are not affected, in the body, not affected by the corona, what they do? They cut and they, do the business. They sell it. That is what, maybe it could be rumors, but we don't know exactly. Okay, you go for some sickness, they do operate, some poor people, they go to hospital, they operate, and finally, something is missing in the body. Something is missing in the body. It has become a business, huge business in India as well as in abroad. Okay, that also we'll deal in detail about the transplantation of the organs. Again, we have the palliative care and spiritual care that we have to give as a pastors to the sick, as well as the family people. The family, when someone is sick, how we have to treat them, how we have to treat them, how we have to respect them, because they are also human beings. We can't minimize them to other category, because sometimes our own mothers, our own grandparents, when they are sick, we know how we treat sometimes, here in India, also outside country, outside India, how they treat, they don't mind at all. They don't give them good food, they don't give them medication, they leave them as as animal being. So that is the church. What does the church say about, the spiritual and other physical care that we have to give when someone is sick? Okay, and finally, we also will deal with moral responsibility with regard to human life. Okay. Good. I have my, I would share with you my personal experience when I was a chaplain in the hospital while I was studying in Spain, Madrid. I worked in 2-3 hospitals as a summer ministry. As a summer ministry, I worked in 2-3 hospitals, as well as in one hospital called St. John of God. St. John of God. They have a good many hospitals here in India as well as abroad. They have good many hospitals. Brothers of St. John of God. I was a chaplain there. On Sundays, I would go as a voluntary. We visit the sick, give them the sacrament, provided if they need some confession and all, they make. And this is small training also we have to undergo. Not that just go and give communion and come back. No. The small training also we have to go listen to them carefully what they are saying, and according to the situation we have to you have to give them answer, etc. So when I thought this is my my coat that I left there. We can't go with the pattern shirt and pant or with the collar also sometimes. It's actually clerical collar. We don't go. Sometimes there are also people who would not believe in church, who would not believe in God. They don't want to see in the hospital priest coming and disturbing them. So we go as a volunteer. As a volunteer, we have to wear this coat. Of course, we have the badge given by the hospital. That's saying you are a pastor, and also you are doing the service, attention to the spiritual and the religious. That you see there, the badge written in Spanish. That is written in Spanish. So we go and we interact and we talk to them. You also listen to them, their pain and their sufferings. Okay, you listen to them, their pain and suffering, especially when they are at the deathbed. So once, when I went to give communion, one 90-year-old, the grandma was fighting for life. Of course, she had cancer. Okay, she had cancer. She was fighting with life, and sometimes sleepless nights. Sometimes they shout and greet. Sometimes make noise. Those who are carrying them in the hospital in the rooms, they can't sleep. It's very difficult. They shout and they keep on speaking, or they have the pain. So the doctor asked me, Father, I want to with the consultation of the physician, I want to bring an end to my mom using the euthanasia. Using the euthanasia, which is permissible in some countries. Euthanasia, mercy killing is allowed or lawful, in some countries. In India, no. In India we don't go, but some of the European countries and in America also, I think, if I'm not mistaken, euthanasia is permitted, but they have to get the permission, from the court, the police, from the physician, etc. So this daughter, asked me, Father, this is the situation. My mom is already 90 years old. She's suffering with a lot of pain, and always she doesn't take any food. She greets, I don't sleep even I see her pain. Sometimes my tears are rolling down, by seeing her condition. Better, why should she suffer so much? We shall go for euthanasia. And what will you say? What will you say? What the church says, we have to explain it. The church doesn't agree, with the term euthanasia, with the science, because human life has to be respected from the beginning till the end of the natural death, no matter what sufferings you have, no matter what sickness you have, but human life, human dignity is to be respected till the end of your natural death. When she said, okay, let her go as it is. How long she can pull up with the medicine? I think she allowed without use of euthanasia. Now what about the science? We have science and development progress, so much help science is doing. Also today science is also issue with the moral. The science want to kill the person who is already suffering, who want to die but cannot die. Science is telling use this method so that the grandma could end up her life. Now the question of morality. What about the morality now? Each life is to be, is protected. So preserved from the moment of the conception in the womb till our natural death. There comes the problem. Again, when I was attending another hospital during summer ministry, a just born baby, dies in the hospital. It was just given birth. In half an hour, the baby is no more. So there were a couple, they were crying like anything. Imagine a mother carries 9 months in the womb, just after the delivery of half an hour, the child is no more. The child is no more. And they were asking, what should we do, Father? Where is God? Where is church? God is so good. God is so kind. Why did God allow my child to die within no time? Also, where is the science? The science and technology has grown so much. Why the science and technology or the biomedical couldn't save this child? It's also another question to be asked. Now I said, no. The couple asked, will my child go to heaven? Because she was not baptized. The child was not baptized. But I learned already, so many fathers of the church, and church holds that any child who dies without receiving baptism, they're already where? In heaven. No matter whether because the childs are innocent. Childs are innocent. That is what we come across, what you call the term limbo. Limbo infants. You can do more readings from library, from the internet. You have the explanation of what does mean of limbo infants. Also, God supplies the grace outside of baptism. Especially these kind of cases. This kind of kids, children who die at the operation theater or just after delivery. They die without receiving baptism. God provides them the grace. God provides them the grace that they are already in heaven. Okay, no matter whether they are baptized or not baptized, but they are already. This is the view of the church. Okay, this is the view of the church. Good. As I said, I did my licentiate in moral theology. My topic was the theological perspective on bioethics and the gift of human life. This is what I was trying to explain. My argument is, we need science, we need bioethics, we need technology. We all need this. But then, let this science and technology not take away our human values, our human dignity. Okay? We need progress. We need progress in society. We need progress in human health issues, in human care. We need development. Whereas we can't think of always just going with the paracetamol. We need some other advanced medicine also for the cure, for the treatment. But then sometimes the technology is so much that we become slave to them. We become human beings are slave to technology, and we lose our human values. We lose our human values, our so-called the dignity. So that was my argument. In my thesis. I leave it to you here for timing. Those who are interested, just have a glance. Maybe we have to look the intention of the mother, or what you call her activity, whether she had some some signs or some symptoms where she showed interest in God, or her faith in God, or her belief in God. We don't know. So it's a Catholic. It's a difficult question. It is a difficult question to be answered, but we have to look her history. Where she was brought up. Was she brought up in Catholic faith, Catholic tradition? She was not going to the church, but rather in the heart, if she had some faith, if she had trusted God, you can say that she is already in heaven. Although she didn't express it outside, okay? She didn't express it outside that I believe in God, I believe in the church, etc., etc. I don't go to the church, I don't receive communion, I was not even baptized. But at the end, before my death, if I have a heart converted, transformed, if I say, yes, now I believe in God, I believe in the church, I need God, I love God, then sure, we can expect, could be positive. The answer could be positive. Okay? No, we will deal slowly. Good. Now, let us move on. Church view on biomedical ethics. Our subject today on biomedical ethics is to inform and educate Catholics, especially you, young seminarians, who are preparing to be a good pastor. Yes or no? You need education. You need to be thorough with biomedical ethics and biomedical science and bioethics, etc. You must learn and acquire knowledge about the topics in bioethics, so-called biomedical ethics. These subjects often call for a detailed knowledge of Catholic teaching. But many of us do not know enough about what are the teachings of the church and how church today addresses on these particular issues. We have to learn and know more about the teachings of the church when we are making moral decisions. When we are making moral decisions in the areas of science, technology, and the use of mission or medicine in our life. To be a good pastor, you must know not only just the Bible, just the scripture, homily, or liturgy, but you also should know the biomedical issues that are connected with our health, our life, our dignity, our human values, etc. Now, for example, if a woman comes to you at your parish, for example, let us imagine, Joseph, you are Joseph? Good. Joseph is a parish priest, the parish here in Eluru. The woman comes to you at your parish, to consult you that she wanted to abort a child. She wanted to abort a child, who happened to be a girl. Now, child is the girl child. The woman wanted to abort it. Nowadays it is very common in India. Many issues, many ladies when they know that, through scanning, through what you call prenatal assumption. So they scan and they see how is the child position, the child is healthy or not healthy. Also, the gender, is a masculine or feminine, boy or girl. Now, the child happens to be a girl, of the woman. She comes to you, the parish priest Joseph, and asks, Father, I want to abort it. I want to abort it because I already have 2 girl child. Now, this is third one, I can't afford in the family. We have to give them for marriage, we have to spend a lot of money. So, she wants to abort it. Now, as a parish priest, what do you think, what advice that you give on behalf of the church? Good. The very fact abortion itself is a wrong idea, wrong concept, not only in the Catholic Church, to be any religion. Killing, killing is wrong, it's a bad, it's evil, unlawful. We have commandment, thou shalt not kill. We have in our Catholic Church, not only in the Catholic Church. You take any religion, I don't think any God is telling you, to kill your neighbor, your people, So the very fact when she says abortion, I want to abort it, we can't say life is a precious. Life is a precious, not after at the 9th month or 8th month, From the moment, from the day it is being conceived in the womb. I repeat, the day or the moment it is being conceived in the womb of the mother, life begins. It doesn't mean you have to wait for the shape of the child to come out, then only life begins. The hands, the legs, and heartbeat. The very day when she conceives in the womb, the life of the child begins. That is what the church and what you call the moral theology would say. So, from the womb itself, the child deserves the child dignity. That's what life. The child can ask you, who are you to kill? You have no right. You are, what you call, you are only giving your what you call your body, to bring up. But the child has got the value, the life, just as what you call each one of you that we have in life. So abortion itself, the fact abortion itself is wrong. We cannot think of if at all she doesn't want, maybe after delivery, we can what you call give it to the orphanage or those couples who do not have children. You can give to them, and our them can see. It's taking place in India many times. This is happening. But there are also many people. They close their eyes and they abort it. Another example. What is your name, brother? Teja. Good. If a pregnant woman, who has some complications, in her body, has the possibility of saving any one life. Either the mother or the child, any one only. That is what the doctors say. Now, the husband, the husband of the what you call the mother, the lady comes to you, as a parish priest again. You are in the parish, Father. I am faithful to the church. I am faithful to God. I want to follow all the commandments. Etc., etc. Now, this is a situation. I am thrown down at the situation where I can save any one life according to doctor's advice. Father, what would you say? I want my wife to be saved. But my wife says, let the child be saved, I shall die. Because we have been trying out and already we are getting old. Better let the child be there. I shall die. Okay, I shall give my life for the sake of my child. But the husband says, no, you are more worthier, you are more precious to me as a wife than the child. It is better that what you call, I can live with you till the end of my age, end of my life, instead of having one child. I want you be at my side than the child. However, the husband is confused now, whether to save the child or to save the mother. Teja is the parish priest. The faithful man comes to Father Teja and he gives whatever doctor says, he shares with him. The church has got different view. The church has got different view. The church will say, we shall try to save both of them. I know there's a danger of losing one, but then church will not say directly, let us kill the child in order to save the mother, or let us give up mother in order to save the child. No, church would never say no, losing one unsaved. Church will say rather, we shall try to save both of them. Meanwhile, in the process of saving, somebody happens to be, well, that is different thing. But the intention is always clear. Intention is saving both. No, I can't openly say, no, let my child die, let my wife be alive. No, or let my wife be let my wife end up her life, let the child be saved. Church will never ever say openly or directly, the intention is always matters. Here comes the importance of double effect theory. We just glanced in the before in the schema, the principle of double effect theory. Okay, we will learn slowly. The people follow the principle of double effect in many situations. The theory of double effect theory in many situations, especially the cases that I shared with you now, often to do with bioethics. To do with bioethics, when they have to decide whether to do something that will have two effects at the same time. The act is one, saving, but will have two effects. One is good, other one is, now good is that you are going to save somebody, either child or mother. And the bad is losing someone's life, either child or it could be the mother. One good, the other evil. We know that we are never allowed to cause moral evil directly. We never allow to cause the moral evil directly. Choosing moral evil to attain a proposed good is never acceptable. Now I repeat, choosing a moral evil to attain something good, doing something bad, doing something evil so that I can achieve something good is never permissible, never appreciated or admitted in the Catholic Church. You agree with me?